So at the first sign of pneumonia, you're going to give her Clavamox. You're not going to give her the Baytril. The Clavamox is the first line of defense, and if she doesn't start getting better on the Clavamox, then the doctor may tell you to give Baytril, but we're starting with Clavamox and hoping that that's sufficient. And you're going to take the foil pack and you're going to just use this mallet and smash the pill in the pack until it's pulverized. And you'll be able to tell that it's all powdery inside. And then when you open it up, make sure that you pour that into the dry kibble before you add the water, and make sure that you get all of the little bits that get stuck in the corner. You want every last little drop of this antibiotic. Okay, if Bella does not improve within 24 hours, you want to talk to the vet and possibly start Baytril. If they recommend that you start it, you're going to give 2 of these tablets every 24 hours. So you're only going to give them with 1 meal a day, unlike the Clavamox, which you want to give with breakfast and dinner. And to grind up the Clavamox, they come in these thick scored tablets. And we found that the easiest thing to do is to cut the tablet in half, and that makes it easier to get it ground up. So here's a Tums that we're using as an example. Just put it in the pill splitter, chop it in half. If it fractures and pieces fall off, then you want to make sure you get those in the mix. And then you take the pill and you set it on its edge in this glass container. And then you're going to take your meat tenderizer and you're going to just smash downward on the edge of those pills. And they crush pretty much like this Tums. Maybe not quite as easily as the Tums, but it is pretty easy. And all you have to do is just smash, smash, smash until you get everything really pulverized and ground up. And then make sure if there's any stuck on the edge of the tenderizer that you scrape it off into the bowl and get all of those good antibiotics in the bowl. The key takeaways are Clavamox 1 every 12 hours at the onset of pneumonia. Call the vet and make sure they know what is going on. And if she needs to go in, take her into the vet for evaluation. And if that means x-rays, then she needs to get x-rays. If they add Baytril, then you will do the Baytril as per the instructions that we gave. Either way, when you first start on the antibiotics, the best practice is to make just a small amount of meatballs and set them off to the side, and then add the antibiotics to that mixture. Before you make the meatballs, add the antibiotics to that mixture so that you just have a half dozen or so meatballs to give her in case her stomach is not feeling good. And you want to get those antibiotics in her and get them working. You're going to continue to try to feed her after you give her the antibiotic meatballs, but if she's not willing to eat, again, you've gotten those in her system. You would proceed with the rest of her food as normal and give her her entire meal if she's willing to accept it. And then once you've gotten past the initial feeling, then when you do your subsequent antibiotic doses, you can give it with the rest of the kibble as part of her meatball mix. And again, this one is 1 every 12 hours. So breakfast and dinner. This one is 2 every 24 hours. So you're only going to give that with 1 meal a day, preferably breakfast or dinner. Don't give it to her midday. It needs to stay at least 2 hours away from the probiotic, which is given during her midday snack.